Hello.
Hello, good
Nice
morning.
to see you. Good morning. How are you?
Nice to see you. I'm doing good. How are you?
Doing well as well.
Yeah,
Happy Monday.
yeah. All right. I guess probably wait maybe 1, 2 minutes, or I guess can get
Sure.
in. Yeah, maybe just another minute to see if people, more people join in. But yeah, thank you for joining us today.
Mhm. Of course. Am I coming in fairly clear?
Mhm. I can hear you well.
Okay.
Can you hear me as well?
Yeah. I think you're a little blurry, maybe, but it's
Okay.
getting better.
See. I'm not sure. That's more effective. See what I can do. Okay. Is that better?
Yeah, a little bit.
All right. I guess yeah, we can jump right into it now.
Sure.
So, hello everyone. My name is Srihita, and I'm a researcher for Brown Women Health. And this is where we basically just promote awareness and of health issues and subjects just concerning South Asian female identifying populations. So, this is my first time hosting a live, as I've been working like a lot behind the scenes. Sorry if I'm linking right, my monitor's in a different place. So, I've been working with blog posts and research concerning mental health. So, I'm pretty excited to actually be on the forefront today. And so today I'm hosting live with Sonya Mital. She's the community engagement lead for Narika, which is an organization that just especially serves people of color facing domestic violence. And so just to add on, our next podcast episode also releases tomorrow for Narika, and it basically just talks about its services as a domestic violence org and how domestic violence has skyrocketed during the pandemic. So hi, Sonia. I'm excited to be able to speak with you today. Would you like to briefly intro yourself and maybe just some background, and then after we can jump to some questions?
Sure. So my name is Sonia, and I have been with Narika as well, first as a volunteer for a couple of years, and then I joined the team officially as our community engagement lead. So that really means increasing our outreach, especially to vulnerable populations, to make sure they know who we are, what we do, why we exist, and can reach out for help if they need it. It's been definitely a very challenging year and a half since COVID started. We've seen helpline calls triple actually during this time, which makes sense. A lot of people have been stuck in lockdown, so it has been kind of a unique challenge to figure out how to increase and improve our community outreach when people are, stuck at home with their abusers. But yeah, thank you so much for having me. Please feel free to ask any questions you have.
Of course, yeah, and I think that's a great mission, and it's pretty crucial to have organizations like that. Again, as you mentioned, in the pandemic where we're all locked in, but yeah, hopefully things with the situation changing with COVID as well. Hopefully, we'll see some statistics, but I guess it all depends what's in the future.
Right.
So, I guess to jump to some questions now. So, as we know, domestic violence takes on many forms, and it really continues to be a significant issue for women of color, even here in the Bay Area. And so, organizations such as NARGA make a crucial effort to bring awareness of like nuances of domestic violence and just overall provide services to survivors. And so, for our audience today, can you give some more background on NARGA's mission and I guess more of the general services you provide as well?
Right. So Narika started in 1992 in the Bay Area. That's predominantly the area that we provide services for. And we were established by foreign immigrant women, most of them South Asian immigrant women, who recognized the need for culturally responsive and linguistically diverse services in the Bay Area, especially for domestic violence survivors. Because this makes sense at the time. There was the whole dot-com boom and tech boom, and everyone was moving here, including a lot of South Asian immigrants. But if you're new to this country, you oftentimes don't know the resources that are available to you. You don't know the laws. You don't know that you can legally separate from your abuser, that you can remain in the US even if you do so. There's a lot of just things that you don't know, and you don't really have large communities to support you. So Narika was created to help with that need because most of our advocates are South Asian immigrants who speak, Hindi, Punjabi, Urdu, Bengali, Tamil, all of these languages that most domestic violence centers they don't really provide. And of course, if you need help, it's much easier to express your experience in the language that you know best. So we offer a variety of services. We have a toll-free helpline where any domestic violence survivor or friend or family member of a survivor can call for help. And we provide case management and safety planning, counseling. We also offer support groups, and then we also do job training and wellness programs to really help with the long-term needs because domestic violence is not something that can be cured in just a few weeks of care. You really need to financially empower yourself. You need to become well and happy too, so that you can take care of others and your children and just live a successful, happy, thriving life.
Yeah, those were some excellent points you made, especially as domestic violence is usually pretty long-term situation. As you
Right.
mentioned, you have to think about the future and your future as well as anyone else you're taking care of. And another point that I definitely like that you made is that you have these cultural differences of immigrants when they come to this country, especially like linguistic barriers, cultural barriers. And a lot of South Asian immigrants face issues of inaccessibility when it comes to proper health services because of situations like this.
Right.
And especially finding services that cater to our culture, to our backgrounds. And so taking a focus on mental health, how does Narika work towards an inclusive mental health care and just health system that actually reaches out to individuals of color facing situations of domestic violence?
Yeah, so one of the most important aspects to, I suppose, culturally responsive care, which we practice, is an empowerment model. So that means we don't, when someone calls for help, we don't say, oh, you must do this, X, Y, Z, like that's the path you must take in order to, reach empowerment. We understand that empowerment means different things to different people, and that maybe not everyone is able or willing to take certain steps, like, for example, legal steps. A lot of our survivors fear that their husband may go to jail or something or get deported, and they don't want that. Or they may fear that they will get deported if they seek help or something like that. So a lot of what we do is kind of debunk common myths that they may have and just help them better understand their options and then empower them to take the choice that they think is best for them. And that may be very different for different people. So it's very much personalized and also very much holistic and long term as well, as you mentioned, because it's not something that you can just recover from very quickly, and different survivors may benefit from different services than another survivor might. So another thing I would say is that we recognize because we are culturally diverse ourselves, we understand the cultural taboos and stigma that often exist in the South Asian community, the diaspora, and also a lot of different immigrant communities as well. A lot of survivors, especially women survivors, which a majority of our clients are, they carry a lot of the cultural stigma and burden and shame of the entire family, oftentimes, and it's often seen as a failure on their part if they're not able to make the marriage succeed, rather than the husband or whoever the abuser might be. So we understand that, and we're able to talk through those situations, and we don't have to ask questions like, "What is the dowry?" for example, or
Mhm.
like, "Why did you do this or that?" because we understand the stigma that's there. And then lastly, I would say we understand the additional complexities that immigrants face, especially around immigration status, and their fear that they may get deported or that they're tied to their abuser forever because of a visa sponsor. But of course, that's not the case, and we can help them remain in the country regardless of if they're legally separated or together.
Yeah, those are all like pretty, I guess, important considerations when we
Yeah,
think of people in domestic abuse situations, and everything is always like subjective. Subjective. You always think of like
right.
this one category of like women in oppressive situations, but there's so many nuances to each woman facing domestic violence and just people in general as well. Obviously, it doesn't just restrict to women, and so I think it's which obviously women are to think about is more justified statistically as well. But it is extremely important to remember that it's a situation anyone can find themselves in. And the points you made about when a lot of the shame does end up coming to women because of the stigmas found in South Asian culture. And so I think it's great that we have organizations like Narika who consider all this that Western organizations wouldn't necessarily understand
Right.
or consider as well. And you are the community engagement lead in Narika. And so I was also wondering, like, what are some ways that you found most effective when reaching out to people in situations facing domestic violence, especially when South Asian women, as you mentioned, as we mentioned, like the stigma, and usually they don't feel comfortable with reaching out to other people because they feel like they carry most of that shame. And in tandem with that, can you just outline, I guess, any corresponding services and programs Narika offers as a means of reaching out to these survivors?
Absolutely. So one of the most successful campaigns we've experienced, especially over the last year, has been our restroom project. So basically, what we did is we put a lot of those flyers. They have like the phone number, and you can rip off the little, shredded paper. So we put those flyers with our helpline and our basic information and multiple languages as well. So, does your partner, whoever they may be, do XYZ, like punch, slap you, or control expenses, things like that, prevent you from going out and seeing people. So we put those in a lot of restrooms, especially public restrooms and in religious institutions and cultural institutions as well. Because what we've realized, especially over the pandemic, is you can't call for help if your abuser's in the other room, right? If you're both working from home, or regardless of whoever works, you're probably spending a lot of time at home because of the pandemic. So how are you supposed to call for help if your abuser is right there? They're going to hear you, right? So the only instances in which oftentimes the women or the victim or the survivor is able to leave is to do errands. So to go to the grocery store, maybe to pray at the temple, or do things like that, like the daily things that maybe the abuser might think, oh, they're just doing errands. There's nothing, dangerous about that. So it's oftentimes the women's restrooms in these places that are the safest space for a survivor to go where their abuser cannot access. And so it's in those locations that they're able to see these flyers and then call when it's convenient for them, as opposed to us, imposing upon them when they're maybe not in a safe space and calling them and finding them and saying, here's what we do. Do you need help? When, we don't know the situation where the abuser might be, or if they may face retaliation if the abuser finds out. So that restroom project has been really successful. Other things we've done is just hosting interesting, fun events. So, like, we have, for example, a Bollywood or Bolly Fusion dance workshop coming up, and it's free and anyone can come. And we know that those kinds of free cultural events are things that survivors may just attend just for fun. And then we're able to speak to communities then and introduce Narika at the beginning or end of those events so that people are aware and learn who we are. Because a lot of times people may not know what they're experiencing is domestic violence, or that there's even a term for it. So if they're, what they're experiencing, they may not know like what to Google, for example. But if they're going to some event that they're just going to for fun, and then we hear it, we tell them, what exactly this is, then they can kind of register in their mind, oh, this is domestic violence. That's what this is, and there's an organization associated with it, even if that's not their intention with attending. So that's been another way to just spread the word, and even reach just friends of people who may be experiencing abuse. Like, friends and family are really, the ones that genuinely care about you. They are there to listen as well, and will hopefully connect survivors with us, even if the survivor themselves doesn't know who we are.
Right, and yeah, that's like another thing I find great about organizations like Narca, where you've been an institute for so long that you kind of now have a latch on like what's the most effective way to reach out to survivors, as it's a pretty susceptible situation, and as you mentioned, like when you, especially in pandemic, when you're on lockdown, you don't know how to reach out when you're with the abuser at all times, and so I think it's
Right.
great that you guys have events to reach out in subtle ways as well, so it's not like immediately like panic inducing or anything. And so,
Yeah. Yeah,
yeah.
just to add one more thing, we've
Mhm.
noticed that a lot of survivors, if they need help, they will probably not think of an organization as the place that they should go to first. They might think, oh, I should go to my imam, or, my Hindu or religious leader, whoever it may be, or I may go to my cultural institution first, or I may go to my elders first.
Right.
Because we in our culture, we often think of those people as leaders or people that we want to confess something to. So one thing that we've done is establish good partnerships with, the leaders of religious temples and cultural organizations, and with senior groups as well, because it's those people that people go to. And if they hopefully go to those people, then they can refer back to us.
Yeah, that's again like an excellent way of just reaching out. And as you mentioned, it's effective to actually reaching out to people in these. That's why I think that it's great that we have these services and again organizations that have been here for a span of time to actually understand what's the best way to like network out to these people. So yeah, thank you for speaking
Right.
with me today. No, it was kind of short, but it was an excellent conversation. I enjoyed learning about just the facets of what goes behind an organization like this, and your role as community engagement lead is so important. So thank you for the work you do. Thank you for speaking with us today.
Of course. Thank you so much. If anyone listening needs help, or if you know someone who may need help, please check out our website at narika.org. That's Narika. Donate if you have the means. That supports our survivors with emergency shelter, transport, support groups, and job training, all of these things that a survivor needs to heal. And if you have any questions at all, do feel free to message us or contact us at narika@narika.org.
Sure, yeah. Thank you to all our listeners for listening. Again, we have our podcast coming up that details more of services that Narika offers. And as Sonya mentioned, definitely go on their website, reach out to their phone number, whichever was appropriate to the situations you are in. Yeah, thank you everyone for joining us today. See you at the next
Thank
live.
you. Bye
Bye.
bye.